Hello, good evening, everyone. Welcome to my IVF Fences. It's great to be back once again and explain and go through our topic today. And today we will talk about male fertility, and we have our expert with us already. Elisa Moya, embryologist at UR Vistahermosa, is with us. Hello, Elisa.
Hello, everybody. Thank you for being here.
Thank you so much for joining. It's great to have you back here, and we had you before, and we
Yeah.
discussed many topics with you. I'm glad that today we will explore this topic, male fertility. I think I repeat it every now and then, but this is still a topic that we want to explore more. I think it's still not discussed enough. I think that Elisa
Yes,
will agree with me on this.
that's true. That's true.
Exactly. So that's why we are bringing this to you. And as always, we will start with Elisa's presentation where she will explain semen analysis and she will walk you through all the steps and what you should know if you don't know already, of course. But afterwards, there will be time for your questions as always. So you need to just put those in the chat so that Elisa can answer them for you. And let me just remind everyone that this is an open space. All the questions you put here are anonymous, so you don't need to worry. If there's anything that you would like to share, ask. Elisa is definitely here for you. So just don't hesitate. This is your opportunity to ask the
Sure.
expert and get a thorough answer, I'm sure. And I think that we can start with our presentation, and I'm really looking forward to it. I'm glad that we are discussing this today. And of course, remember to put the questions in the chat. You can do it during the presentation or afterwards. And I think we can go ahead with the presentation. Elisa, ready?
Perfect. Yes. Thank you so
Brilliant. Thank you
much.
so much.
Yes.
Let's go ahead.
So, first of all, thank you for being here tonight with us. I hope you will enjoy this presentation. And as Caroline said, if you have any question, you can write it down, and I will try to answer it the best way that I can. So, as Carolyn said, we are going to talk about male fertility. We're going to explore a little bit of male fertility, as you can see here in the index. Um, First, I'm going to talk about causes and environmental factors that can affect male fertility, and then a little bit the most common tests that we do here in fertility centers. So, infertility is defined as the inability to achieve gestation after 1 year of unprotected sexual relations. It affects almost 15% of the couples of reproductive age, and the male factor is responsible for up to 40 to 50% of the cases of sterility of the couple. So concerns about semen quality have increased in recent years due to the decline of the seminal parameters set by the World Health Organization. And although this fail in values does not imply sterility, it results in difficulty in getting pregnancy. So there are multiple cases that can affect semen quality, as multiple factors that may interfere with the proper formation of the sperm, which is called spermatogenesis, and the transport by the male genital system, that's from the testicle to outside with ejaculation, or even in the fertilization process. So the most common causes associated with male sterility are varicocele, which is the swelling of the veins inside the scrotum, infection in the seminal root, immunological pathologies, developmental anomalies, endocrinical pathologies, mechanical causes, for example, disturbance in erection or ejaculation, also genetic causes, and toxic drugs, occupational factors, and advanced paternal age. And today we're going to focus on the last two ones, which are the environmental factors and the things that we can do to avoid or improve for a better seminal quality. So as I said, we're going to focus on environmental factors such as toxic factors, life habits, and everything we might be in our power to improve or not worsen the quality of the sperm. Scientifically proven to have an influence on seminal quality are obesity, smoking, drugs, and chemicals. Let's start talking about obesity. Obesity, it's understood a body mass index of more than 30 kilograms per square meter, and it's associated with some health problems, as you might know, mainly cardiovascular, such as high blood pressure, diabetes, or also hypercholesteremia. But fertility is also affected. And this is because obesity is associated with hormonal changes that can lead to a reduction of seminal quality. And how does obesity affect fertility? Well, it's because of testosterone. It's one of the hormones that is involved in spermatogenesis. And it has been found that when a high amount of fat is present, testosterone levels decrease and estradiol levels increase, which inhibits sperm production. The volume of the sperm can also be affected, and in addition, a low level of testosterone may lead to problems of erectile dysfunction and consequently difficulty in achieving pregnancy in a natural way. Well, we all know that with the creation of ICSI, it has allowed couples in which men that have low seminal quality or ejaculatory problems to help them to become pregnant. But recent studies have analyzed that the results on this type of treatment, by comparing the results of treatments where the male have a normal versus a high body mass index, it has been found that the overweight may adversely affect the outcome of this treatment. The link between smoking and seminal quality has been demonstrated widely. Tobacco consumption has been mainly associated with a decrease in spermatozoa count and damage in the DNA of the spermatozoa. So cigarettes are mostly composed of nicotine, alkaloids, amines, ketones, and innumerable toxic substances. And all these substances have been detected in the seminal plasma because they cross the hematotesticular barrier, directly influencing the quality of the sperm. And also recent studies suggest that tobacco components lead to increase this DNA fragmentation of the head of the sperm. We will see this later on, but this increase in spermatic DNA ruptures may have a negative impact on natural fertilization process and also on the results in assisted reproduction techniques. So there are multiple drugs that can affect fertility, but the most harmful drugs for reproduction includes cancer treatments. Chemotherapy and radiotherapy are very aggressive treatments for spermatogenesis also. And depending on the type of the drug and the radiation dose, the effect might be definite or transient. So that's why it's essential. So we always will recommend it, and it's very, very essential to freeze the sperm preventively at the time of diagnosis of a systemic or oncological disease, which by itself or by the treatment endangers the future fertility. Other drugs that may affect fertility are immunosuppressors, neurodrugs such as antidepressants, antiepileptic or neuroleptic drugs, and also hormones, for example, anabolizers. Anabolizers are anabolic androgenic steroids, and these are synthetic derivatives of testosterone. It's used by many sportsmen to enhance athletic performance and appearance, but the adverse effects includes a lot in the liver, in the behavior, but also in reproductive system. And this negative impact on spermatogenesis is often or most of the time irreversible. So as you know, alcohol is one of the most widely consumed substances. There is an increasing number of studies linked with alcohol consumption and a reduced fertility in both in men and in women. And alcohol consumption may alter testosterone secretion and also spermatogenesis. In fact, the European Association of Urology confirms that heavy alcohol consumption produces significant spermatozoon morphological changes and also a decrease in seminal fluid volume and lower sperm concentration and sperm motility. And also very important, it has been demonstrated that alcohol increases sperm DNA fragmentation. There are some increased risk in certain occupation that requires close contact with substances or physical agents that are toxic to fertility. The list related to this occupational exposure includes pesticides that will affect farmers, radiation or heat that also affects workers in foundries, glycol ethers that also will affect foundry workers. And it also has been documented that physical agents such as heat or radiation and also some metals are toxic to sperm in workers with high exposure. But further investigations are necessary before definite conclusions are reached on these factors. And that brings us to talk about electromagnetic radiation. The use of mobile phones, laptops, and wireless internet technologies has increased concern about the effect on male fertility, as these devices constantly emit electromagnetic radiation. This radiation could alter male reproductive endocrine mechanism and so affect testicular functions. Exposure to mobile phone radiation decreases sperm viability, motility, and sperm total antioxidant capacity in investigations with animals. This is why there is a need to conduct more studies of the biological effects of this radiation on human reproductive system, because it's not fully determined. Well, the average age of parenthood has been increased in recent years, mostly in Western countries, in parallel with the increase with the maternal age. So the importance of women's age for reproduction is well known, whereas for men is less known, although there is an increasing scientific evidence. And although there is no universal definition of advanced paternal age, such as with women, the most widely used criterion to define it is more than 45 years at the time of the conception. The physiological aging of male reproductive apparatus can be manifested in various forms. For example, oxidative stress will increase, and that will cause cell damage, including DNA damage, a decreasing levels of testosterone, and that will reduce also sperm mobility and the volume, lower embryonic quality in assisted reproduction technologies and or treatments, an increased risk of psychiatric diseases in the offspring, such as TDAH or autism, and also an increased risk of miscarriage. So, for evaluating the quality of the sperm in reproductive clinics, we offer different kind of tests. Today we will see a lot of them, the most of them, and we will talk a little bit about them. First, we have the semenogram or the spermogram. The semenogram is the study of the sperm quality. It's essential before starting any assisted reproduction treatment. And although we will see other types of studies that are also important, the semenogram is the most basic and at the same time one of the most important that we should perform. we will always use the updated World Health Organization parameters and values. The spermogram or semenogram is divided in two studies or two parts, the macroscopic study and the microscopic study. The macroscopic study, as the name refers, here everything that doesn't need a microscope is analyzed, and that would be the volume that is measured in milliliters. The semen sample is normal when it has a volume that is greater than 1.4 milliliters. The pH, sperm normally has a pH between 7 and 9. Variation in pH outside this range is associated sometimes with the presence of an infection, and also the viscosity in the liquefaction, because before using the ejaculate for any analysis, it needs to liquefy naturally for about 20 minutes to be able to perform the study, and it must be completely liquid. On the other hand, we have the microscope study that also, as the name refers, everything that needs a microscope is analyzed here. Okay, and that would be, for example, sperm concentration. Here, a sperm count is performed. The number of sperm must exceed more than 16 million per milliliter for the sample to consider normal. Also, sperm motility or mobility. The percentage of motility spermatozoa in the sample is analyzed, as well as the way they move, because they can move fast progressive, slow progressive, or non-progressive. A sperm sample is said to be normal when it's more than 32% of the spermatozoa move progressively. Then we have sperm vitality. There are several tests to see if there are dead spermatozoa and they ejaculate. In the most of the clinics, we use eosine staining. You don't really need to know that, but just if you want to have the information, I'm just telling you. For the sperm sample to be normal, it needs to be more than 58% of the sperm must be alive. Then we have the sperm morphology. Here, the shape of the spermatozoa is evaluated, and we analyze each sperm for abnormalities. At least 4% of the sperm must have a normal shape to consider a sample normal. And also the presence of leukocytes. At most, there should be 1 million leukocytes per milliliter, because a higher number of leukocytes is an indicative of infection. Sometimes we need additional evidence for further analysis, and among them we have diagnostic capacitation that measures the progressive motile sperm count, sperm DNA fragmentation test that measures the lesions in the genetic material of the sperm, and then we will have sperm fish test, which detects the genetic abnormalities. Today we will focus on sperm DNA fragmentation and sperm fish, because they are quite important. Sperm fragmentation refers to lesions, damage, or breaks in the genetic material of the sperm, and it's one of the major causes of male infertility. The causes may be intrinsic, that means imperfect sperm maturation or even genetic alteration can cause this, or external issues, as we already talked before in the presentation. Studying sperm DNA fragmentation hopes to improve the chances of a success in IVF treatments, because sperm DNA fragmentation cannot always be prevented, but there are some ways that you can help, and there are some laboratory techniques that we can do to improve this alteration. Sperm DNA fragmentation, it's recommended when pregnancy is not achieved after several unsuccessful attempts, but the real indications are in unexplained infertility, repeated implantation failure, poor quality embryos, men that had or have varicocele, men who are 45 or older, chronic diseases like diabetes, and also men that smokes. As I said, there are some techniques to improve this alteration. The most used and clinically tested is the MAX technique. This is an immunomagnetic technique that selects spermatozoa that do not show signs of DNA damage or cells that are in death, okay, death of the cells, which is also called apoptosis. These damaged sperm can be removed from the sample because the membranes of the damaged cells contains markers that can be detected. So what we need to do is an incubation of the sperm and annexin, which is a protein that will be created with magnetic microparticles. Here, this protein, annexin, will bond with the ill spermatozoa, okay? And we will pass all this mix of sperm and annexin through a column where a magnetic field has been applied, so that the spermatozoa with DNA damage or apoptosis will remain inside the column, and the healthy spermatozoa will swim through it, as you can see in the picture. Okay, so then we can use these healthy spermatozoa for ICSI or for any fertilization. Okay, and now we will discuss the fish test, which is also very important. First, I'd like to explain a little bit the biological basis so that you can understand a little bit the purpose of this test. So humans are diploid species. In other words, we have 2 copies of each of the 23 types of chromosomes. When our cells divide to form reproductive cells, like oocytes or sperm, they only carry one set of chromosomes, making these type of cells haploid. Okay, this process is called gametogenesis, and gametogenesis is not always 100% efficient, and there are some certain proportion of gametes with an abnormal number of chromosomes, and this is called aneuploidies. And problems arise when aneuploidy levels in a sperm sample are high. So patients with pathological fish analysis in sperm have a higher risk of having embryos with chromosomal abnormalities, and also that can influence in implantation failures, pregnancy loss, and the possibility of giving birth to children with abnormal karyotypes. So this is why the indications are for couples with a background of recurrent pregnancy loss, recurrent implantation failure, male partners with poor semen quality, and male partners with abnormal karyotypes. Okay, so if some alteration is observed, indicating a higher proportion of spermatozoa with a certain chromosomal alteration, we would advise to consider at least one of the following options: to perform a pre-implantation genetic diagnosis to check that the embryo does not present alteration, and perform the embryo transfer with those who have a greater probability of implanting and evolving since they are genetically normal, and also to make a prenatal diagnosis in case of gestation. So to conclude, remember, fertility is not mathematical. It's a combination of factors, and that's why it's important to know everything that we have commented on today. It should also be in mind that each case is unique, and before testing or changing any life habits, it's better to be advised by a specialist. And also there are many sperm tests that we can perform, but it's also important to know what should be indicated for each patient. Okay, so thank you very much. And now I'm ready for all your questions, if you have.
Okay, we can see you now. Good. Thank you so much for your presentation and explaining all those bits and tips, of course, about analysis, sperm analysis, of course. And as you mentioned, we are ready for your questions. There are some questions ready.
Yes.
Remember, this is
Okay.
time. Don't hesitate. If there are more questions you wish to ask, we are starting our Q&A. So let me go to the question from Anita here. This is the first that we,
Mm-hmm.
and
Mm-hmm.
let me just read it for you here. So, my partner's morphology of the sperm was 10% of normal shape in August 22, 2% of normal shape in November 22, and 1% of normal shape in March 24. What analysis can we make? Is there a progressive degeneration of the shape of the spermatozoa? Does this mean that in a few months it could be close to zero of normal shape?
Well, I have to say this is a very rare case because morphological values of sperm are not that variable. It's more common that the same person has the same uh, percentage during his life. But maybe here it's something happening, and of course they need to analyze this. Um, I wanted to ask what kind of test did they make?
Yeah, if Anita, if
Only
you can
seminogram?
add it,
Okay.
sure. And in the
Because
meantime,
maybe
there
here,
is this, sorry, there is this
okay,
one more information that, of course, all other parameters are good. So volume, concentration, motility, vitality, pH is
okay.
also good.
Interesting. It's a little bit weird, as I said, because morphology is quite stable. For example, concentration is more. It can have more variations among time. But of course, here maybe they should see. I'm not saying that they shouldn't be in this clinic, but have more opinions, having more tests from other clinics so that they compare it. And if it's really that low and if it's really going under. Also, if the partner is having some stress or if he's smoking or if he's having a bad habits, uh, maybe this could be a reason.
There is a follow-up. Let me go straight to that one. The no
Mm-hmm.
smoking or bad habits. It was a spermogram and spermoculture analysis that they did,
Mm-hmm.
done in the same laboratory. Yeah, those three tests were done at the same lab.
Okay, so maybe they should have a seminogram in another clinic just to compare. That would be my.
Doesn't hurt to see, to try.
It
Yeah,
doesn't-
to compare it as you said. Mhm.
Okay, yes.
Okay, thank you so
And
much.
I mean, if they wanted to do an IVF treatment, um, and if they have only 1% of good morphology and sperm, of course they would use ICSI. Okay, with the ICSI technique, you select the best sperm. That's why it's used most of the times. Okay, so
Mhm.
that would be it.
Okay, that makes
Okay.
sense. Thank you so much. If there are any follow-ups, as always, we are here, so don't hesitate. And let me just go
Yes.
to the next question that we have here.
Mm-hmm.
So Michelle would like to know, so is DNA fragmentation analysis included in routine assessment process every time? You've mentioned this during your presentation as well, actually.
Well, yes. For doing DNA fragmentation analysis, um, well, the sample should be fresh and used in this moment. I don't know what you really mean with routine assessment.
I think that perhaps it's about, whether it's done like semen analysis, then you have DNA fragmentation. Is it done every time before you even
Oh,
begin?
okay. No,
Yeah.
and well, in our clinics, we have to do it separately, depending of the couple, as I said, and of the what's the infertility case. We can recommend to do just seminogram or also DNA fragmentation.
Mm, yeah. Thank you. I think that's clear enough.
Mm-hmm.
Okay. Okay. Are you able to tell us here? It's a bit of a longer question, sorry. So if there had been repeated implantation failure or untested blastocyst embryos, could this be due to DNA fragmentation, even though the embryos were a blastocyst stage?
Yes, well, in this kind of, well, DNA fragmentation is more related with bad development of the embryos. Okay, so if the embryos were good blastocytes with good quality, I think here maybe could be more something chromosomical, more than fragmentation.
Okay, so this should be checked first of all, rather than
Yes,
focusing on
yes. I would
DNA
focus more
fragmentation.
on that. Yes.
Okay. Hope that helps again. Of course, if there's anything else you wish to follow up, you can do it. And so,
Yes.
what is the cutoff point of DFI in IUI in ICSI? Are you able to tell us DFI?
I don't really know. We don't use it here. EUI, we use it for a kind of freezing sperm, which is ready to use, but I don't know if this is the question. I don't know.
Okay.
Maybe in every country they have different cutoffs for different names.
Sure, of course. If you are able to perhaps just give us a bit more information, perhaps we can go back to this one. Okay, let me just. Yeah, it's sperm
Oh,
fragmentation index. Yeah,
yes. Okay. So what is our
cutoff
limit?
point. Yeah, cutoff
Yes.
point.
Okay, it would be 30% of the sperm DNA that it's damaged.
30%.
Sperm that it's damaged.
In
Yes.
IUI and ICSI as well.
Well, IUI, I mean, but what do you mean? Because ICSI is a technique where you take the spermatozoa and
This is
you microinject. So the sperm fragmentation index doesn't really have that much to do.
okay. This is the
Okay.
question that we've got. So if
Okay.
you can just let us know if this answers exactly your question, or if
Yeah.
you can simply explain what you exactly mean. Okay, if we missed anything like that. So
Of
thanks a
course.
lot. Okay, and let me just have a look. So it was sorry. There is a follow up from Anita from previous patient. So
Uh-huh.
sorry, it was the same. Sorry about that. So let me go to the next one. So
Okay.
does the ICSI technique handle issues of DNA fragmentation if that may be present but not tested?
Does ICSI handle issues? No. ICSI techniques, what it helps is to pick up the best morphology and motility, the best sperm. I don't know if I am explaining myself good. For avoiding DNA fragmentation, you should do the MAX technique. That's what I explained before. It's a technique that you do before doing ICSI, so that when you have your ICSI technique already, you put the sperm that has already done the MAX, and you confirm that the sperm doesn't have any DNA fragmentation.
Okay.
Sperm that's used for the ICSI. Yes.
Okay, and actually, why we are talking about ICSI, okay?
Yes.
I think that it comes quite a lot. It's a question that comes up a lot.
Yes.
Is ICSI recommended as part of every cycle? Do you do it in every cycle at your clinic?
We don't do it in every cycle, and we recommend it only if the sperm has an alteration. If the sperm has perfect conditions and there is no infertility from the part of the man, we try to do conventional IVF.
Okay, crystal clear, I think. Are you able to tell us more or less the percentage of
Well, it's
ICSI
more, I would
procedures, or?
say, maybe we have a 60% of ICSI, 40% of conventional IVF.
Yeah, thanks so much for that as well. Okay, and let's have a look. So, can you improve sperm parameters? Would you recommend any supplements?
Well, yes, there are some vitamins that can improve, but I think it's better that your own doctor recommend you your vitamins in your country, and it's always different. So I think this is better for a doctor to recommend it.
Of course, that makes sense. Again, thank you so much. And I will go back to that ICSI question because we have a follow-up. Is conventional IVF less expensive than ICSI?
No, it's not. It's just what it's better for the patients to use a technique or the other one. It's not really cheaper or expensive.
Okay.
Also,
Thank
there
you.
are patients that really they only really want to do conventional IVF because they want it this way. Okay, so in these cases we do it, but it's better to see how the sperm is and how the ovocytes are, and then making a decision.
Okay. Thank you for this again. So does frozen sperm retain its quality after it is thawed?
Does rather maintain it? Well, I see another question later on that it's related.
Yeah, sure.
It doesn't really retain. Well, it doesn't really decrease the quality of the sperm, but we can see less motility sometimes when we freeze a sample. That's normal to lose a percentage, a 10-15 percentage of motility of the sperm. And some sperms also don't survive as well as others. So sometimes we have a little bit of loss of that, but not really significant.
Okay. Yeah.
And
Thank
the
you so
same
much.
as with the DNA fragmentation,
Okay.
it doesn't really affect it that much.
Okay. So nothing to really worry about, at least not
No.
too much when it comes to freezing. Okay, and that I don't see more questions. However, if you have more questions, there's still time for you. You can go ahead, type those in. I think that we still have some time.
I just
But
wanted to add one more thing. So
definitely, sure, we have
you
time.
shouldn't be afraid of freezing sperm, because if you were afraid because your sample have a high DNA fragmentation, you still can do max technique on a frozen sample. Okay, so it's not really need to worry.
Okay, thank you for adding that. I think that
Okay.
sometimes people can get worried. So thank you for the reassurance. And
Yeah.
as I mentioned, if we will be finishing, if you have more questions, but now I see one more here. So we were advised there's no need to have DNA fragmentation as needs ICSI due to severely low sperm concentration and motility. Do you agree with this? We have already had one failed round of ICSI.
Well, I think it doesn't hurt anyone to do a DNA fragmentation test. If you already had a failure ICSI or IVF cycle, I think the more information that we have, the better it will be. So we would recommend it, of course, if you already have a failed cycle, of course.
So you would say that DNA fragmentation, it would be better to actually go ahead and do it.
Yeah, so we will have more information on what went wrong here, why didn't this ICSI went well. Yes, the more we know, the faster we will go with everything.
Sure, of course. Thank you so much for that. Again, I believe that was helpful for you, Karen, as well. Someone is typing. We need to give it a minute to see. Yeah, there's a thank you from Karen, but still, I see someone is typing. So we need to be patient and wait for the question. So let's do that. In the meantime, I will double check. Yeah. So does having red wine 2 bottles a week have effect on sperm?
Not really. 2 bottles a week. I mean, it's not. Well, everything is relative, of course, but I don't think that this is a high amount of alcohol. And what I was talking about, I think it's more when you daily consume alcohol and for a meal and for evening, I think there we have a problem. Of course, drugs and alcohol and tobacco will never be good, but in small accounts, I don't think that it will have any damage.
Okay. Thank you again for that. So does hypertension, drugs affect sperm?
Well, I don't really know about that. I think maybe you should comment that to your doctor. We know for sure that there are some drugs that affect sperm because they're very aggressive, such as chemotherapy or neurological drugs or hormones, of course. But I'm not really sure if hypertension drugs affect it. Um, it's better to consult it with a doctor.
Yeah, of course, definitely. This kind of thing is always best to double check it, and it's always best to tell what kind of drugs you also take you need, right? In order to
Yes, of course.
that's I think it's quite normal to do
Mm-hmm.
that. And we will go to the patient Anita who asked, yeah, so if you can have a look. So
Mm-hmm.
regarding the shape of the spermatozoa, so in our case we have 1% of normal shape, 99% of no abnormal shape, out of which 98% is abnormal shape of the head.
Mm-hmm.
Will this normal shape of the head, will it influence ICSI result, fecundation rates?
Okay. And then she asked if I can explain the exit technique. Okay.
Yes. Mhm.
Okay. So as I said, with this kind of abnormality that is the shape of the spermatozoa, and we can use exit technique. Here, what we are going to do is we're going to micro inject each sperm that we select in the ovocyte. So we have we the biologists, we have our microscope and we search for the best spermatozoa. Okay, not only in shape, also in movement, and and then we will select these sperms for the microinjection. So in this way, we can have much better results with ICSI in the outcome of the treatment. Okay.
Okay. I hope that helped. Again, let us know, of
And
course.
I know that 1% sounds very, very low, but you have to think that if you have a high number of spermatozoa per milliliter, 1%, it's still a lot because we're talking about millions of spermatozoas. So if you have, for example, 5 ovocytes, we only need 5 good spermatozoas.
Doesn't sound that scary then, right? So yeah, thank you so much for reassurance again. And so how much you mentioned this during your presentation,
Yes,
we can
I,
go back to the presentation because of course I can show it again, I think. How much
okay.
is the good sperm count for male fertility? I can
It's
pull
more
the,
than 16 million per
yeah.
milliliter.
Yeah, for sure.
Yeah.
You can have a look, of course, at our recording. There will be some parameters there, and you can double check it. It will be available tomorrow on our website, of course.
Yes, of course.
And I'm waiting. I'm waiting for some more questions. Someone again is typing here, so let's see. So okay, why do consultants give doxycycline antibiotic treatment for men with poor sperm result? My husband was given it for 40 days, but I didn't really understand why. Are you able to help us with this?
Well, we don't how do you say recitate. We don't give the male patients antibiotic for the treatment, so I don't really know why they do that. In our clinic, we don't do it. The only thing that we can do is to give some vitamins um, for 3 months, for example, so that the sperm can maybe be better and increase the volume or the amount of spermatozoas.
Mhm. Okay. And Anita would like to, yeah, okay, so this is a follow up, of course, right? But you still need to succeed to find those 5 good spermatozoas among millions of bad ones. It will take you a lot of time. This is
Well,
just
but
a part.
maybe she doesn't know that when we treat sperm, we do the capacitation, and with this capacitation, we will have only the progressive sperms. Okay, so we put away a lot of not moving sperms, and it's easier to find them that way.
Okay. So this is possible, so don't worry, of course. I know that you know what you're doing at the lab, of course, right? So
Yes.
definitely. Thank you so much for reassurance again. Are you able to tell us about this one? So is Proxeed good to have to improve sperm count? If yes, should it has to be taken? If it's in powder form, I'm not familiar with this one, so cannot say. Proxeed.
I'm also not familiar, and as
Sure,
I said, it's better that a doctor recommend it.
definitely. Yeah,
I'm not a
sure.
doctor, so I cannot recommend it.
Yes, definitely.
But
So please remember that if you have questions regarding specifics like this medication, for example, it's better to double check with your fertility specialist. So thanks a lot. Yeah, and not a problem, as you can see. No worries. Thanks. Um, okay.
oh,
Okay. What about Zymed? As you can see, someone added this here.
yes, well, Simon, it's very similar to Max. It's almost the same. So yes, it work, and we are starting to use them. So,
Okay.
but it's very similar to Max. It's the same method. Uh, so yes, it improves a lot.
Okay, so it's helpful. You are using this also at the clinic you started, and similar
Yes.
to Max
Mm-hmm.
as well. So if there's anything else, yeah, maybe something here. So let's have
Yes.
a look. Yeah, thank you.
Thank
All
you.
right, brilliant. Thank you so much. Thank you so much, everyone, for all those questions. It's great. It's a great discussion indeed. Lots of different topics as always within just one
Yes.
topic.
I
But
hope I have answered everything.
I'm sure
Uh,
you did. And of course, remember that if you wish to have some more, if you have more questions, you can always get in touch with Vistahermosa and the team directly. I'm sure they will be happy to help you out. Elisa, I think we will be finishing for today. So thank you, everyone, for joining. Thank you for your time. I
Thank
know
you.
that you are still at the clinic and you are, I'm sure, ready to go home and to rest
Well,
a bit.
yes, but
So thank you so
we
much
love our
indeed for your
job.
time.
So,
That's good to hear for sure.
yes.
And as you can see, there are some thank yous coming up your way. Before we
Thank
finish, as
you.
always,
Mhm.
anything else you wish to add?
No, just thank you for listening. And I know it's late. So I'm really glad that you wanted to hear the speech. And I just hope that everything goes well with your treatments and that you don't have to be around these clinics more time than necessary.
For sure. This is something that we all wish for all of you. So thank you so much for joining. I
Yeah.
believe it was useful for you. And we will be back actually next, not this Thursday, sorry. We will be back this Thursday. We will talk about IVF and actually financing options, etc., with Dr. Alan Thornhill. So if this is something that you are interested in, and this is a huge topic indeed as well, I mean, I'm sure. So if this is something you would like to ask about and find out a little bit more about, then go to our website, myivfances.com, and you will, and I hope to see you there, and you will have a chance to ask your questions once more. So thank you so much, everyone. Have a lovely evening, Elisa. Lovely to have you back here.
You too.
Looking forward to some more events as always. And everyone, have a lovely evening and see you soon. Bye.
Bye. Bye. Thank you.